Wellness for Life is brought to you by Back in Motion Physical Therapy, Gothenburg Chiropractic Clinic, Mahabi Atwa Community Action Partnership, Lakeside Sports and Pain Clinic, and Thomason, Swanson, and Zahn Attorneys at Law.
Hi, I'm Dr. Mark Wheaton, physician and owner of Lakeside Sports and Pain Clinic in Excelsior, Minnesota, and right here in Monaga, Minnesota. Today I'd like to discuss with you the problem called rotator cuff arthritis or tear. And rotator cuff injuries are very common in overhead throwing athletes such as tennis or baseball, but it also afflicts those who are in an office setting or activities in work such as painting, reaching overhead. And so it's a very common condition and it can cause a lot of pain and disability. So I'd like to show you what a rotator cuff consists of, and in so doing we can understand why this tissue gets overloaded and is susceptible to injury. So let's take a look at the diagram right now. Okay, so what we see right here are the muscles of the rotator cuff. And it consists of 4 muscles. So if we look at the front view, there's a subscapularis muscle, and then if we look from the back view, there's a teres minor, an infraspinatus, and the supraspinatus. And they all coalesce to form the rotator cuff. That's the portion of the tendon that joins those 4 muscles together and inserts right on the bone here. So if we look at it, we have the supraspinatus that allows a person to raise their arm away from their body, such as like this, all the way to the top of the head. And then we look at the external rotation provided by 2 of the muscles in the back of the rotator cuff that allows that external rotation. And then likewise, there's a muscle in the front of the rotator cuff that will rotate that arm in. And so all those motions allow this range of motion or freedom that gives us the ability to reach up our back, behind our head, overhead, out in front. And that gives us the freedom and mobility to perform many activities. But because of that, it's also susceptible to overuse and to wear and tear because of the lack of stability that often is inherent in the shoulder. So I would like to show you a little closer look again at one of the diagrams that indicates some of the structures that might be injured. So here in the close-up view of the rotator cuff, we see a diagram of rotator cuff tears that are starting to occur. And these tears interfere with the normal functioning of the rotator cuff, and even though the person can still move their arm around, it will cause pain. And they'll often report of pain when they start to raise their arm above their head, off to their side, or when they reach back behind the car seat. Other times they might just reach out in front and have problems where the pain radiates into the front of the upper arm or into the back of the shoulder. It often is a dull pain. It can be achy and often can be sharp as well. If it ever gets to the point where the person cannot even raise their arm from their side, often the tear is quite massive at that point. So I'd like to take a subject now and just show you an examination of what I do to diagnose rotator cuff injury. So I'm going to ask the patient now if she would perform a couple of movements for me. Could you raise your arm up above your head, just straight in front of you, all the way up? Okay, that's good. And then bring it down again. And then do the same, bringing it up to the side. Okay, good. Now, did that cause pain? No, okay. So then I take the arm and I do a movement where I'm testing, I do this little wing movement. And what that does is test to see if there's any impingement, because it forces the rotator cuff up against that bone. And if a person has rotator cuff impingement, they will express pain. And likewise, if I raise this arm up directly, the same thing will occur. The person will experience pain. Another thing that I do that a lot of physicians don't do is I take the shoulder and I try to slide the ball in the socket to see how much play is in the joint, because that can indicate an underlying problem of hypermobility leading to injury to the rotator cuff. So once I've done that, then I use my thumb to palpate or press on areas right where the rotator cuff is located, along that edge of the bone, and also the rest of the joint, both front and back, to see where the tender spots are. And so in so doing, I can determine not only where the problem is, where the pain is coming from, but then it acts as a template for where I want to do my injections. So let's discuss the injections that I do. Obviously, most people don't want to have surgery. So what I can do with treatments of prolotherapy and also companion treatment called platelet-rich plasma, or PRP, is use natural solutions, or in the case of the PRP, a patient's own blood, and inject that into the rotator cuff tendon and the surrounding ligaments and correct the underlying problem. So instead of resorting to cortisone or anti-inflammatory drugs or taking that step to surgery, the injection process is natural, replaces the damaged tissue with normal tissue, and strengthens the entire joint and relieves the tension and the pain that occurs in rotator cuff injury. So it makes a lot of sense to get a preventative treatment so that a person doesn't have a continual degenerative process lead to an unnecessary surgery. So prolotherapy and PRP are the two best interventions at the point in time when a person is no longer able to function normally with their shoulder, and can restore that person to their sports that they love, to their work, to even sleep. Sleep can be disrupted with rotator cuff injury, and oftentimes it's a complete resolution in just 3 or 4 treatments of prolotherapy or PRP. So if you would avail yourself of either of those treatments, you can contact our office at Lakeside Sports and Pain Clinic, or check us out at drmarkwheaton.com. I think you'll be very pleased and satisfied with the results that you get with both PRP and prolotherapy.
Coming up on Wellness for Life.
Hello, my name is Sarah Swanson, and I am an attorney partner at the law firm Thomas & Swanson & Zahn in Park Rapids. We are here on the Wellness for Life series again to tell you a little bit more about our elder law services, estate planning services, and geriatric care management services that we offer at our law firm. For many years, we've offered a wide array of legal services for our elderly clients, and in the last couple of years, we have been providing geriatric care management services to our elderly clients. A geriatric care manager is a licensed professional social worker or a nurse trained and certified as a geriatric care manager. We employ at our office Laurel Haid, and she is a social worker geriatric care manager. Through our geriatric care management services, we offer many non-legal services to our clients, and today Laurel is going to share a little bit more about how we go about starting and initiating the client relationship for geriatric care management. Laurel?
Thank you, Sarah. So one of the things that the geriatric care manager wants to do first off is a family meeting, and that's making sure that all the family members are able to attend, and if not, we do conference calls at that time as well. A family meeting is set up to help everybody be on the same page as the client and oftentimes it's parents. And so we do an agenda. I put an agenda together according to what the children and the parents are wanting to talk about. And then we all meet together, and the care manager, the main goal is to be the facilitator, to help direct the meeting, to help it stay on task, and just have that conversation so everybody's able to be heard. The care manager assists with allowing the children to all voice their concerns, but also the parents to be able to voice their concerns. And then together we put it all down on paper, and then we have conversation. And a lot of times it's problem solving, coming up with some solutions. One of the things we like to do if there's a caregiver taking care of her spouse, What are the things that the children can do to help problem solve maybe the housework is getting too much for the mother, or baking and cooking and those kinds of things. So then we do share the care, and we make a list of who's able to help with what. So maybe one of the children is really good with numbers and they can help with bill paying at the end of the month. Maybe another one likes to cook and they can make meals and maybe make their meals bigger and put them in smaller containers for the freezer. So mom just has to go into the freezer and pull out something for supper instead of having to make it that night. Maybe another one does like cleaning house, and that one maybe could come every other weekend and put in a couple of hours of helping to clean. But it's all problem solving, but also just making sure everybody is on the same page and allowing them to voice their concerns, and then the geriatric care manager can step in the areas that they can't help with. And a lot of times that's doctor appointments, which we will talk about on our next segment.
Thanks, Laurel. As she said, we are happy to meet with clients for this initial family meeting, and we can take the legal services or the geriatric care management services to wherever is shown that it's needed as a result of that first family meeting. We'd be happy to schedule an appointment with you or your family wherever it's most convenient to you, in our office, or sometimes it's even easier in your own home. So please give us a call today and we would love to meet with you.
Thank you for watching Wellness for Life. Brought to you by Back in Motion Physical Therapy, Gothenburg Chiropractic Clinic, Mojave Ottawa Community Action Partnership, Lakeside Sports and Pain Clinic, and Thomason, Swanson & Zahn Attorneys at Law.